Posterior support. Posterior stops can be added at any time to support the temporomandibular joint. It is extremely important that there is a space bilaterally between the trays prior to adding the acrylic posterior stops. The objective is to create bilateral, even posterior stops at the patient's treatment position. Since the relationship of the maxilla and the mandible changes with the changes in protrusion, this procedure must be repeated if the treatment position changes. First, lubricate the posterior of the upper tray with petroleum jelly. This will prevent the tray from sticking to the acrylic when adding acrylic posterior stops. Add cold cure acrylic to the molar area of the lower tray. Have the patient place the tray in their mouth and hook the trays together. Have the patient slide their jaw side to side. This will flatten the posterior stops into place. Have the patient remove the lower tray from their mouth. Place the lower tray in hot water to cure the acrylic stops. Trim, smooth, and polish the posterior stops once they fit properly. Have the patient place the lower tray back in their mouth and hook the trays together. Check the posterior stops for fit and function. Make any adjustments necessary. When the tap is in the patient's mouth, the final vertical opening is kept to a minimum of 6 millimeters. This allows lip competence, which improves the patient's comfort.